Welcome back to continue our discussion talking about liver disease. Joining me again, Dr. John Fucci with St. John's in Sapulpa, gastroenterologist and hepatologist. Now let's jump in. When we finish our first segment, you were talking about that stage 2 in terms of inflammation. What will the person themselves begin to experience? I mean, how do I know my liver is inflamed? Because sometimes, you know, things can progress and you don't know it until it's like really way out there. But in that stage 2 with inflammation, if I'm that individual, am I going to feel something or have some type of symptomology?
Most individuals have no symptoms whatsoever. They would only notice this if they went to their doctor and had liver function tests as part of a evaluation in their physical examination or other problems, and they were noted to have these abnormal liver function tests. So most people are asymptomatic. When you talk to them, though, some of them may have some fatigue, which is a common symptom with liver disease.
Okay.
And occasionally you'll see a patient who has right upper quadrant pain, pain on the right side of their upper abdomen. And as the liver gets enlarged with fat, it sometimes can stretch the capsule of the liver, which is the surrounding tissue around the liver. And those have nerve endings. And there are a few patients who will complain of pain associated with this swelling and stretching of the liver.
Now, would they have some of these symptoms if they're eating like foods that are high in fat? Because like you said, the liver is storing the fat. It's not, you know, being able to deposit it in the adipose tissue, et cetera, like it normally would, right?
Actually, it's not so much fat. It's actually more carbohydrates the problem. Because remember, fat can get stored in the liver. Right. But as important, and probably more important, is carbohydrates, which if you don't convert them to glucose and use them in your muscles for when you need energy, they are converted to fat in the liver. And the odd thing about our metabolism is we can convert sugar into fat, but we can't convert fat back into sugar. It's a strange sort of thing, so the fat tends to stay there, and it has to be used in the form of free acid, which can be used as an energy source too. So fat, that's why fat's kind of nasty.
Yeah, and so with this, so if the person was eating a high carbohydrate meal, would that tend to trigger more of the symptoms that they may feel if they're feeling any?
Exactly. It tends to be part of the process. The high carbohydrate meals tend to stimulate more insulin production. There's some insulin resistance, and there's more storage of the fat into the liver. So it's as much ingestion of carbohydrates as fat. Protein, not so much. But it has to do with the metabolic problems we have with obesity, where there's insulin resistance, there's stress on the pancreas. When we talk about insulin resistance, it means that the sugars that are produced are not able to be sent out and absorbed into the muscle tissue where they can be used. Right. So the metabolism of sugar is abnormal. Sugars go up, more stress on the pancreas, more production. But in the liver specifically, the real culprit is fat, because the carbohydrates get converted into fat, and these fats seem to be associated with this free radical formation, which are little chemicals that are toxic and can cause inflammation and scarring of the liver.
And that's good to sort of re-emphasize this role of carbohydrates, because it's doing different things, whether it's through the sugar production or the fat storage capacity within the liver itself. Now, when we look at this and we think about it before we get to stage 3, the increase in obesity, you're saying, is one of the cofactors that can really trigger this. What about children? I mean, we're a society now where obesity is an epidemic, especially among youth. Are you seeing fatty liver younger in terms of the age population compared to just in adults or older? You know,
yes,
how is that working?
It's disturbing because diseases we only saw in middle-aged or older adults are now seen in children. I have seen fatty liver in patients as young as 12, and there have been reports of 8, 9 years old individuals. They also have high blood pressure, elevated cholesterol. They talk about, quote, metabolic syndrome, which is a combination of diabetes, hypercholesterol levels, and high blood pressure. So it's part of that syndrome, and we're seeing that in children, which is scary.
Very scary. Now, what is stage 3? Because already 2 doesn't sound too good. What is stage 3?
Stage 3 is what we worry about the most, is when the inflammation causes damage to liver cells. and the liver tries to regenerate itself, but it can't really do that because it forms scar tissue. So whenever there's inflammation, the body tries to heal itself by forming scar tissue.
Okay.
Now the liver is capable of regenerating cells, but unfortunately, in the process, it forms scar tissue. And that's what really causes a lot of the problems with liver disease. As you lose cells and form scar, all kinds of bad things happen in the liver, which results in chronic liver disease and some of the problems we have.
Okay. Now, when we think about this in these different stages, you talked about liver function tests, especially early on, that maybe the only way the person knows is by liver function tests. Is this the kind of test that we should make sure when we go for yearly physicals that it's always done, or is it always a part of the yearly physical? You don't really have to ask about it.
It's not always part of it. Often doctors, when you come in for your yearly physical, particularly in older women, will tend to check thyroid function because low thyroid is very common. They'll tend to check cholesterol levels, but they may or may not check liver function tests. A lot of them do because of the epidemic of this fatty liver, and a lot of doctors are starting to do screening liver function tests on people who have a little insulin resistance, a little high blood pressure, and they're obese, and they'll be elevated, and then they can refer them to the appropriate liver specialist to determine what stage they're at and what form of treatment.
Okay, so this is something that, especially if you are obese or having some issues that are pre-diabetic, that you need to make sure that you're asking for at least on a yearly basis. And is that enough? Is having a yearly liver function test enough, or should it be more frequent?
Well, that's a good question. We don't really know how frequently we should check it, but I think if you have periodic over several years of at least yearly liver function tests, there's a chance that if you have the disease, one of them are going to be up. Now, the thing about fatty liver is that the liver function tests tend to fluctuate, like we see with other diseases such as hepatitis C, and one test may not be enough. But if you do several over the course of several years, you usually, if you have significant disease, you will see one or two that are elevated.
Okay, well, our last couple minutes want to focus on treatment. What is the treatment for fatty liver?
Well, the main treatment is weight loss and exercise.
Okay.
And but that's very difficult for a lot of patients. I really stress, particularly in women, to have a combination of aerobic exercise, diet, and also weightlifting, because when women increase their muscle mass, that makes their tissues a little less insulin resistant. The sugars and carbohydrates are tended to go into the muscle tissue. So a weightlifting program is really important. You don't have to go out to the gym and, with the big muscle heads and start lifting heavy weight, but some lightweight lifting. A lot of these gyms have machines that can put less stress on the body. So some type of weightlifting exercise with some type of aerobic exercise and diet. And there are many ways of dieting. Weight Watchers can be helpful, some of these other programs. But it's really important for these patients to do this, and it should be a slow, steady weight loss. In fact, the boomerang effect is not good. If you tend to go in there and lose 20 or 30 pounds and then gain it right back a month later, that may be more stressful to the liver than if you stayed at the same weight. So we try to avoid that. We try to keep a gradual, slow weight loss. But as you know, that's a difficult thing. Our society's having a tough time with weight loss. If you just watch any daytime television, there's all kinds of aids and things like that, which most of them don't work very well.
Now let me ask this question with the weight loss, and that especially if it's gradual and it's being sustained. Will this reverse the fatty liver condition, or just stop any damage or further progression? What does that do?
It can completely reverse the disease.
You
can, it can reverse the disease in terms of liver function tests normalizing, and you can see less fat in the liver on a biopsy. So, yes, it can reverse the disease, and that's the primary therapy.
Okay, now I'm going to ask you a question when we come back from break on fatty liver. One more question, then we're going to switch over to look at some of the other hepatitis conditions. Please stay with us. We'll be right back.